The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering bioidentical hormone replacement therapy. With us, we have an expert on the topic, Dr. Rollins. Dr. Rollins, welcome to the program.
Thank you, Randy. It's nice to be here.
Now, before we get into today's topic, which is a hot topic these days, tell me about your center, Western Colorado.
The Integrated Medicine Center is a collection of different practitioners, myself included, representing the medical wing of things. I have several partners who are nurse practitioners. We also have a naturopathic physician. We have an acupuncturist who specializes in traditional Chinese medicine. We have a homeopathic and massage therapy specialists. We also have a registered dietitian, and one of my favorites is an exercise physiologist that quite a lot of my patients take advantage of.
Now, you call it integrative medicine, so define that. Help me understand.
Well, integrative medicine to me has several meanings. In the traditional sense, and what you'll find at most universities, integrative just means integrating different types of practitioners. So we have medical specialists, we have naturopathic doctors, we have acupuncturists who do traditional Chinese medicine, we have dietitians, we have exercise physiologists, we have behavioral psychologists. We have all these different disciplines integrated together into our center. And the unique thing is, integrative medicine is not just seeing all these different practitioners. It's the practitioners coming together to actually collaborate on your care.
Is that right? Now, so in your practice, who is the typical patient that is coming in for hormone replacement therapy?
Probably the typical patient for me might be the recently menopausal or perimenopausal woman. Let's say she's 48, 50, 52 years of age, somewhere in there, starting to have classic symptoms, you know, night sweats and the hot flashes and these kind of things, seeking relief of these symptoms. And this brings up an interesting point because I explain to patients, these are withdrawal symptoms. When your estrogen levels are dropping and your pituitary gland's telling your little ovary to make more estrogen, you have these pulses of the hormone that causes hot flashes and night sweats.
Is that right?
So that stops after a year or two in most women. Some women it goes on longer, but usually it stops. And you know,
so that's the first sign of what, hormonal decline?
That typically is the first sign of estrogen decline.
Okay.
And that is a withdrawal symptom that will go away in time. That is not the reason necessarily to take bioidentical hormones. The reason to take bioidentical hormones is to prevent disease, to maintain quality of life. And so when I'm treating someone that's 52 years of age, yes, they may have a lot of symptoms that are quite disturbing, and it's great to get those better. At the same time, we're thinking 30 years ahead. We're looking at estrogen cutting the risk of heart disease and Alzheimer's in half.
So the other type of patients that you're seeing, so menopausal women.
Yeah, another classic is women. What most women don't realize is that some of their hormones start declining in late 30s, early 40s. Progesterone is estrogen's sister. And progesterone is a hormone that starts to decline normally late 30s, early 40s in most women perhaps.
How do they know? How do they know if you're low on progesterone?
One of the biggest symptoms is they become more estrogen dominant. It's not that they're making more estrogen, it's just that they're not making as much progesterone. And again, they're sisters, they complement, they balance each other, they antagonize one another sometimes. When women's progesterone starts to fall, their menstrual cycles may get heavier, more cramping, more premenstrual syndrome, more uterine fibroids that leads to a hysterectomy commonly, sadly, more breast cysts that lead to biopsies. And these can be alleviated with progesterone cycling, simple as that.
You know, when they say progesterone makes women feel better. Is there truth to that?
Yeah.
Is that right?
Think of estrogen and progesterone like sisters. And estrogen will stimulate the body. It stimulates the skin, the breast, vaginal tissue, the uterus. It stimulates the brain. So women can think clearer and they feel good. Progesterone calms all of that. So it keeps estrogen from running rampant in the breast and in the uterus and over-stimulating that tissue. At the level of the brain, progesterone has to be one of my favorite hormones to help women with, because when you give them progesterone, it calms the brain. It complements estrogen.
Is it good for things like anxiety?
Very much
light
so.
depression?
Progesterone stimulates GABA receptors in the brain, the exact same receptors that Xanax and Valium stimulate.
Really? Now, so I know about natural hormones. Should a woman wait, and I did some research, that I guess menopause can be defined by missing a period for 6 to 12 months. Should they wait? I mean, are women coming in way before that? Should they come in before that?
Oh, absolutely. I love catching women in their early 40s when they're just starting to have some early changes in their hormones. Sometimes it's not that far out of balance. Sometimes it's drastically out of balance. And I can't tell you how many hundreds of women I've seen who went through this 10-year period where their progesterone dropped out. They didn't know. They just suffered through it until they finally got...
Suffered like what? They just feel lousy?
Lousy.
Low energy? Does it?
Doesn't so much get into low energy per se as much as strictly speaking with the ovarian hormones. It's more about the menstrual cycle, and it's more about estrogen dominance. And so they suffer in the sense that they have anxiety, they feel irritable, they can't sleep. They're estrogen overstimulated only because there's no progesterone. So you give these women progesterone for a week or 2 or even 3 out of every month, and it typically will just stop all those physical symptoms.
How fast can a woman feel better, by the way?
First month, first cycle.
Really?
Quite frequently.
What do they say?
The very first month. They're very happy.
They call and say, I mean, do you ever hear stories like, I got my life back, I feel much better,
I've had dozens of women cancel their hysterectomy.
Really?
Because it changed their physiology so much that they stopped going down a path that they assumed was inevitable.
Okay, so you're not just replacing like just one hormone, 2 hormones.
No, that's right. And that's a great question about one hormone versus several hormones. A long time ago, I realized that you cannot look at just one of these hormones and ignore the others. If you're low on your cortisol, for example, cortisol is a very important adrenal hormone. It doesn't necessarily decline with aging like some of the other ones, but people get into pathological conditions where cortisol might be low, and cortisol helps our blood pressure, our blood sugar, and our immune system. So when I look at hormones, I have to look at multiple systems. As an example, if you're low on cortisol, an adrenal hormone, then you're not going to tolerate the correct amount of thyroid, which is one of your metabolic hormones. And if you're low on thyroid, none of your sex hormones are going to work optimally. You're not going to metabolize them properly, and your receptors are not going to be as sensitive to them. So it's very important to step back and look at all the hormone systems and get them all in balance and in the correct order as well. Okay,
testosterone in women. I don't even think of women as having testosterone levels. How important is that hormone? How does a woman know if it's low or needs to be replaced?
Testosterone is very important in women, just like in men. Clearly, they don't need quite as much as men, but testosterone builds muscle, builds bone, burns fat, has a lot to do with your sex drive, has a lot to do with your sense of security, confidence, motivation, get up and go. And it's just as important in women as it is in men. A lot of women get their estrogen and or progesterone replaced and never get their testosterone replaced. And so they suffer specific detriments because of that.
So how do you give the hormones? Are they pills? Are they injections?
Well, let me tell you about that, because the way you give the hormones is very important. You cannot just simply give these hormones in a pill that you swallow. Sometimes that's okay, sometimes it's not. And it's important to really recognize that. Most doctors around the country and around the world who know about bioidentical hormones tend to use creams. We'll use creams that you put on your skin, you rub them in.
And they just go right through?
They're absorbed directly into your bloodstream. Because when you think about it, your hormones do not go through your digestive tract where they see your liver to get metabolized. That's called first pass metabolism. And that does a lot of things that is not normal. So when we give hormones, we like to skip the first pass metabolism that you get when you swallow a pill and it sees the liver first thing. That's not natural. So when we give it topically, it's absorbed right into your bloodstream. A second way that I use a lot is a tablet that dissolves right under your tongue. We use that twice a day, so you get smoother blood levels. That's very slick. You can take it and pop it under your tongue and you're out the door, and it's very easy. So we put estrogen, progesterone, and testosterone eventually into one tablet or one cream. We tend to start out with them separately so that we can independently adjust them. That's a really important point.
What about energy? I mean, is that one of the main things?
I get people coming to see me that are so tired, they want to exercise, they want to feel better, they want to build muscle, they want to be more active, but they just feel too lousy to get up and go do it. Men and women. And when you get to be 55 or 60, you do not have to feel lousy. You can actually regain a lot of that youthful energy that's normal when we're 20, 30, 40 years of age.
Is it hard for people to, as I'm sitting here, I'm a little skeptical, period, about just about all the medical topics we cover, but this is one of those that I always hear people talking about how great they feel and this and that. Do people think you're exaggerating sometimes?
I'm amazed at the feedback that I get from patients, and it's exciting and it's encouraging to learn more about this area. When you have people who walk back into your office in their first follow-up visit and say, "I can't believe how much better I feel, thank you," or when a woman says, "I haven't felt this good in 25 years," or when a man says, "Thank you, I haven't felt this good in 15 years. This is exciting.
Okay, now you flew in here in San Diego, in California, it's mainstream out here. I mean, when you hear people over 40, they're taking bioidentical hormones. And but in your area, how responsive are they to this? Are they more skeptical? And what message you want to send to them? I mean, what do you want them to know?
Where I practice and live in Western Colorado is not Southern California, and this is a newer concept for a lot of patients. But you know, what's really, really neat is that my experience with this started in a very rural, very conservative medical area. And by being people's physician for 15 years and simply explaining to them about these hormones, it makes perfect sense.
So you're sold on this.
And
I mean, you believe this.
They jump on it. I have patients who are doing so much better. They not only feel better, which is important, but their heart disease is under better control. Their diabetes is under better control. They're building back their bone if they have osteoporosis. They're seeing things in their lives get better. Ailments are getting better because of it.
Do you think in all areas of medicine, because you're also, I know you work in the emergency room as well, do you think this is where you have the most impact in this type of medicine?
That's a great question, and you know, it's really fun to be a physician and help people when they're sick and when they're ill with chronic diseases, and do the best that we can. Truthfully, by the time diseases are so far established, you're already kind of behind the 8 ball. So a lot of bioidentical hormone replacement, by definition, is designed to keep the machine running optimally and prevent those diseases. That's very exciting. I can tell you that when someone walks into my office having a heart attack, and you get to do things to save their life, that's very gratifying, and it's satisfying to be able to help someone at that level. But at the same time, it's really hard to stand there and realize I could have prevented this from ever happening.
Really? You believe that, though?
Absolutely. Now, it's not just hormones. You know, we really emphasize nutrition. We emphasize basic exercise. We emphasize stress and spiritual type connections. And we also, you know, have to look at modern medicines are wonderful.
Backing up for a moment, because I have questions about testosterone. It's good for the heart.
There are hundreds of
studies.
How
so? I mean, why is it good for the heart?
Well, testosterone is good for the several things. It's good for the lipid parameters. It's good for the lipid numbers. It's also good directly for the lining to the artery. It's also good for the muscle to the heart. I mean, there are studies showing you can give testosterone to a man having a heart attack just like you can nitroglycerin. And it's helpful. If a man is having angina with a certain amount of activity, you can replace their testosterone and they can do more.
So you think it's protective? Okay,
it's
so people watching this,
it's
heart disease runs
protective.
in their family. If they take topical testosterone, you believe that it's helped them?
Oh, absolutely.
Really?
There have been 3 big studies in just recent years that have finished. A 6-year, 10-year, and 18-year study looking at men in their 60s, some low on testosterone, some normal. What happens to those men if you just watch and see what happens? Basically, over about a 10-year period, there's about a 50% increased mortality in the men with low testosterone.
Okay.
That's a big number.
So the studies show this?
These 3 independent studies have similar results. And when you extrapolate the data to about a 10-year mark, it's roughly a 50% increased mortality. We're talking more heart disease, more cancer, more broken bones.
What about women? What about women? Does the same apply?
There's a lot more data on men, to my knowledge, of course, which intuitively makes sense. We've studied testosterone in men perhaps
Number
a
one
lot
killer
more
of
than
women is still heart disease.
Number 1 killer in women is heart disease. Women who replace their estrogen early, meaning right at menopause, and stay on it, have half the rate of heart disease.
Really? Tell me this, though, and when I talk about this with my friends, this always comes up. Well, you take hormones and it could grow cancers or it could cause problems. Is that true, in your opinion?
No, not at all. We're not talking about super physiologic doses of hormones here. We're not talking about synthetic steroids that are 10 or 100 times stronger than testosterone. So we're talking about replacing the normal level of the exact hormone that's been in your body your whole life.
Okay, so you're measuring it through blood, through saliva.
Absolutely.
How do you measure?
Different doctors do this differently when it comes to getting the doses right. I tend to adjust early in women hormones based on their physiologic response. As long as we're in a common dosage range, women have a very different sensitivity to hormones. So there's not one blood level that's perfect for all women, just like there's not one dose. And so you have to be careful about chasing a blood level around to get the right dose.
Interesting.
So my logic is more to start with a common sense range. I base my dosing on a woman's age, on her history, maybe on some initial blood work if we even need initial blood work. Sometimes if a woman's post-menopause, her estrogen and progesterone levels are low, so we don't even check blood levels. They're going to be low.
Okay.
So we tend to start treatment and we look for a physiologic response. And we teach our patients, we go into a lot of detail teaching them signs of too much or too little hormone. That way they know precisely if they're getting too much.
Now you describe it as a symphony. Elaborate on that, doing hormones.
I first heard that term, Dr. Pam Smith, who's a real expert in this field, describe it as a symphony of hormones. And I really like that analogy because it is different pieces of the puzzle. You can't simply replace one hormone.
So they all work together?
Absolutely. Okay. You can't hand someone a steering wheel and tell them to have a nice car trip. You need the rest of the package. It's the same analogy in a human. You can't just have estrogen without progesterone and testosterone. You can't have thyroid without the right amount of adrenal hormones. These hormones all interact in a very complex puzzle.
Is it tough to sell prevention? I mean, because people, they're 90, they're living long, but they're living, terribly.
It's not. It's really not. It's exciting. Okay. We have a very savvy, educated population out there now. Thank heavens for things like the internet. People can read a lot. Sometimes they read too much, but honestly, it's wonderful because they come with a lot of knowledge and a lot of good questions. These are people that are motivated. They want to stay healthy. They want to stay off medications if possible. So this is great to practice with people who are thinking ahead 20 or 30 years. They not only want to feel better today, which is important, they want to prevent diseases that might be coming in 20 or 30 years.
Okay, what about sex drive, libido?
Yeah, sex drive is a big one. I see so many men and women, early 50s, no libido.
But isn't it just part of aging?
Well, it is part of aging, just like degenerative diseases are part of aging. And if you just stand back and let nature take its course, yes, then that is a normal part of aging. However, if we realize that you can replace these hormones that prevent heart disease and prevent diabetes and prevent osteoporosis, isn't that much, much, much better than having to take prescription drugs to help fix the problem after it's already there?
But with sex drive in particular.
With sex drive in particular.
Have you seen it turned around where
absolutely. You'll see men and women. With men, it usually takes about 3 or 4 weeks for them to start noticing some increased libido from testosterone.
We're going to take a quick break. We come back. I want to know what they can expect when they go in on day one. Kind of take me through the consultation process, how you evaluate hormones, and come up with the prescription. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're discussing bioidentical hormone replacement therapy. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about bioidentical hormone replacement therapy. With us, we have an expert on the topic, Dr. Rollins. I want to lead and go into this next segment about thyroid. And I know you're very aggressive with thyroid, the way you look at it, and adrenal function. But your center, you say it's one of the most comprehensive of its kind.
Yeah, the Integrative Medicine Center was designed specifically to be a one-stop shopping for patients to get multiple aspects of their health care addressed. Now, it's just wonderful to have patients come see me. They're interested in more energy, feeling better, anti-aging, hormones. But if they're missing nutrition, if they're missing exercise, if they're missing stress relief, then there's only so much that I can do with these hormones.
Okay.
I've felt very limited as a primary care physician my entire career because I see these people, I give them dietary advice, and I know that we need to do more for them. It's human nature. People need help with these things. I need help.
So you can't just take hormones and not
absolutely not
eat well, or else it's not going to work.
Hormones don't work properly if you don't have proper nutrition. Selenium and zinc and magnesium, many things play a role in helping hormones actually do what they do. Now, diet is so important. It's our first medicine. Having a dietitian at the Integrative Medicine Center, having an exercise physiologist at the center has been wonderful. So I can see these folks who come to see me for hormone replacement. I realize that nutrition and exercise are missing pieces of the puzzle for them.
Okay, so everybody, I think, knows that you have to exercise.
That's true, but if you're feeling so lousy that you're not sleeping well, you get up in the morning, you have no motivation whatsoever, it's really a tall task for people to expect to exercise, honestly. I get them feeling better with hormone replacement, suddenly a little light goes on and they feel more motivated. There's a light at the end of the tunnel. They start feeling better. They start eating better. It's a self-fulfilling kind of prophecy. As you start feeling better, there's a reward there. And people, it's really exciting to see people take this and run with it, you know. If I can help them sleep better and simply feel better and feel more motivated and feel more energy and stamina, suddenly they're going to start exercising more as a natural consequence. That's where we bring in our exercise physiologists to help train them. You take a lot of young women who are 52 years of age, they're in the prime of their life, they should be feeling fantastic. They may have never had any exposure to formal strength training. We do that right in the center.
Okay.
A lot of people are pretty savvy about diet, but there are some particular things that people need to learn. It's great to have a dietitian right at the center where people can get that knowledge and walk away with that.
Now, do you believe, as we're reading, researching this topic, that the second half of your life can be the best half of your life?
Boy,
from
I sure
50
do.
plus?
At age 45, I sure do.
Okay.
Because I think that, by the time we get to be 50 years of age, most people have made a lot of mistakes and figured out things in their life. And that's a sad time in life to start feeling fatigued and have weight gain and issues that they have no control of.
But is it realistic to be able to feel the way you did in your 30s when you're 50? Is it? Do you hear those stories?
Well, I'm a realist about this. I think that as we get past 50, 60, 70 years of age, of course we're never going to be exactly like when we were 18. But absolutely you can have the energy and the drive that you had when you were in your teens and 20s. You betcha.
Is that right?
And you can have your metabolism back. How many people hit 40 or 50 and suddenly they're doing the right things? They're exercising, they're eating right, but they just can't help it. How many men get to be 50 and start developing a beer belly around the midsection?
Everyone.
How many women start having body composition changes? Fat getting redistributed to the middle. A lot of this is hormonal, and they can't do anything about it.
So when you replace hormones for people that all of a sudden can't lose weight the way they used to.
That's right.
They can now.
That's right. Testosterone and estrogen both help your insulin work better. Testosterone builds muscle, burns fat. It helps break down the fat that we accumulate around our midsection. Progesterone, for example, helps keep cortisol from putting fat around the middle. So all these hormones conspire to help our metabolism. Thyroid is your master.
Okay, let's talk about
furnace.
thyroid. You have strong opinions about thyroid. Tell me about that.
I do have strong opinions about thyroid, and I've ended up in somewhat of a controversial area without ever intending to.
Really?
One of the more common blood tests that we do for thyroid is called a thyroid-stimulating hormone, TSH. This is the gold standard that most doctors use to diagnose and monitor thyroid conditions. Now, what I have found simply by observation over decades of treating patients is that it doesn't always jive with a patient's actual thyroid hormone level, and it doesn't always jive with the patient's symptoms. So years ago, I started scratching my head about how to reconcile this and very conservatively giving patients thyroid hormone, even though some of their blood tests may suggest they're normal. Exactly. Now, when these patients start feeling better, when their hair loss stops, their dry skin, their brittle nails gets better, when their metabolism revs up and they're not cold all the time.
So cold hands and feet is a thyroid problem usually?
Typically with low thyroid, women especially are going to notice hair loss. That's a big one, pulling hair out in the brush or in the shower.
Really?
But they're going to have trouble losing weight. They're going to feel fatigued and sluggish. They're going to gain weight even though they're doing everything right.
So if they were told elsewhere, thyroid was okay, chances are
absolutely. I get patients from all over Western Colorado who come in and give me a laundry list of symptoms that go with low thyroid. I'm suspicious they're low on their thyroid before we ever do a single blood test. It's that simple. When we do blood tests, we don't just get the TSH screening test. We actually get the prohormone and the active hormone levels, and we corroborate the whole picture. Quite often, people's pituitary gland, the TSH-producing gland, disconnects from their actual hormone levels. Now, that's not the typical case, but I can tell you I have hundreds of patients who have fallen through the cracks because of a normal TSH.
Fallen through the cracks of the medical system.
Absolutely, and with all due respect for my colleagues and my training, this was how I was trained, but frankly, I've seen that break down and fail. So,
your approach. Most women go to their medical doctor, they're feeling lousy, maybe a little bit of depression, anxiety, and I've been told they're giving like an antidepressant.
Yeah,
this is not your style.
Most women come into their physician and their mood's down, so they get Prozac. They're not sleeping well, so they get a sleeping pill.
But it doesn't work.
Marginally. But it's putting a Band-Aid on the symptom. It's not really getting to the root of the problem. The heart of integrative medicine is functional medicine as well. And that's what that means is figuring out what system has gone wrong. Let's fix the system. Let's not put a drug onto the symptom. Let's fix the underlying condition. That's functional medicine.
So you deal with people with anxiety and depression
absolutely.
that you're able to wean off?
Absolutely.
Really?
All the time. I'm very respectful when people come to me on medications that are for mood. Quite frequently, usually, they're they're able to stop those medicines. So when a woman hits menopause, she does not begin to develop a Prozac deficiency. She does not develop a Xanax deficiency. She does not develop an Ambien deficiency to help her sleep. She doesn't need Ditropan to help her bladder.
So these are all declining hormones?
These are all because of declining hormones.
Interesting.
And so if we remedy the hormone imbalance, the symptoms get better because the underlying condition has gotten better.
Has this become more mainstream with the medical doctors, by the way? I mean,
It
I
sure
know on
has.
my show it has. I mean,
It sure has. Even in my part of Colorado, we have some excellent primary care physicians, and there's an awakening to this type of hormone replacement. I get a lot of my colleagues that have known me for a long time as a family doc, and I'm getting a lot of referrals from some of my colleagues to help with some of these conditions. It's very exciting.
Now with and men and women go through the same thing, this hormonal decline. Yep. What if you feel great, like me? You feel great? Why would I want to do it?
That's a great question. A great question, because I'll occasionally get a 55-year-old woman who went through menopause with nary a symptom of withdrawal. She feels great, and we step back, and she comes in and says, "I'd like to do everything I can to promote good health." Perfect patient.
Really?
Because we're not treating symptoms, we're preventing disease at some level.
We're just about out of time. But final message: a woman watching this in her 40s just doesn't feel as good as she used to.
The final message is that there is something that's changing, and you can do something about it. And you can either take prescription medications to manage the symptoms of hormone decline, or you can fix the underlying issue, and that is supplement your hormones back to a youthful level.
So how long does somebody stay on them?
You should
I mean,
stay
is
on
this
them
something
forever.
you do forever? Okay.
You should stay on them forever. And again, that goes against a little bit of the conventional advice, which is to take them as short a time as possible. That misses the point. The point is to prevent disease and to maintain quality of life.
So by keeping your hormone levels up, you believe that you can prevent a lot of the diseases associated with aging.
The science clearly shows that you can prevent a lot of disease and maintain quality of life for a much longer period of time if you keep your hormones at a youthful level.
All right, very interesting. Great topic. All of this is on your website?
Absolutely.
Find out more? Okay. Well, I appreciate your talk, and very interesting. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.